So the paper that I chose to talk about deals with the improvement of heart attack prediction using different types of feature selection methods. Brief introduction. Heart attack is a leading cause of sudden death, and that's especially prevalent in third world countries. It can be diagnosed using many clinical methods such as electrocardiograms, blood tests, as well as seeing if you're prone to heart attacks using family history, as well as trying to prevent certain risk factors such as eating better or exercising more if you're obese. Alongside this, machine learning methods are also being employed. And the goal of this paper was to determine not only the best machine learning method, but also the best feature selection method to predict heart attacks. So the data set that was used was the StatLog heart data set. This data set contained 217 records as well as 13 attributes. Continuous attributes included age, resting blood pressure, serum cholesterol, which is measured in milligrams per deciliter, maximum heart rate achieved, old peak, which is the ST depression induced by exercise relative to rest, the slope of the peak exercise ST segment, as well as a number of major vessels colored by fluoroscopy. The dataset also contains some categorical and binary attributes such as sex, chest pain type, which was composed of 4 different levels, fasting blood sugar greater than 120 milligrams per deciliter, so that's a binary variable, resting electrocardiogram results, which were either 0, 1, or 2, exercise, induced angina, thalassemia, which had 3 different levels, as well as the presence of heart disease, which was the target variable. So for the methods, there was a few different types of machine learning algorithms used, such as binary logistic regression, decision trees, multi-layer perceptron, neural networks, naive Bayes, support vector machines, including linear kernel, polynomial kernel, radial basis kernel, and sigmoid kernel. Optimal parameters were chosen for each of the algorithms, obviously. Performance was evaluated not only on the accuracy of classification, but also how fast it was performed. First, each of the algorithms were performed on the full data set using all features, and then finally subsets of the features using the feature selection methods, which included backward selection, forward selection, Fisher filtering selection, and relief selection. So this is just a screenshot from the paper itself showing what each of the feature selection methods consider to be the most important features in predicting heart disease. For the results and findings, basically we found out that most classifiers performed well on the full data set. The highest classification accuracy was achieved when using the relief feature selection method, but feature selection did not seem to have a notable effect on processing time on most algorithms, and the authors attributed this to the number of features not really increasing model complexity for most of the algorithms. SVM linear and naive Bayes gave the best results. SVM polynomial gave the worst results, and then the KNN, ROC, area under the curve results were the best. This is also another screenshot from the paper itself. Just shows you the different accuracies and how long it took the machine learning algorithm to perform the classification for each of the different feature selection methods. And then finally on the right side, on the whole data set. This is just showing the ROC, area under the curve, results. So KNN seem to perform the best overall, basically in each of the different feature selection categories, as well as the full data set. Okay, so this is a diagram of the ROC curve. I'm sure most of you guys have already seen this before, so I'm not going to go too in depth with it. But basically, the false positive rate is on the x-axis, and then the true positive rate is on the y-axis. And then a random classifier will have an AUC of 0.5, and that's the red dashed line, meaning that it'll just be randomly guessing for the predictions it makes. And then a perfect classifier will be the top purple line that'll have a AUC of 1.0. And then also, as we saw a few slides ago, KNN had a AUC of 0.93, 0.94, so it's getting close to being almost a perfect classifier. This is just a comparison to other similar studies that were performed in order to classify the presence of heart disease using the same data set. As you can see, this study so far, at least when this was done, was the best one yet, and it boasted a 84.81% accuracy using SVM linear, and then a 84.44% using SVM sigmoid kernels. For conclusions, it looks like SVM, naive Bayes, and KNN are the best for predicting heart attacks, which were similar results to the other studies. But overall, most of the algorithms did pretty well. They boasted an accuracy of at least 80%, which is a promising result that can be used alongside clinical methods such as the ECGs and blood tests. Also, it seems that feature selection increased accuracy, so not only is it important in this context, but it's probably going to be important for our group project that we're doing in this class. So for some comments and maybe some small concerns, first off, the data set is pretty small. It only contains about 217 records, so it's hard to tell if the models and the algorithms can be generalizable in other contexts, or if they're actually really good at predicting whether or not heart disease is present. As well as prediction accuracy is extremely important in this context, so you don't want to say, or you don't want to tell someone that doesn't have heart disease that they do, or even worse, tell someone that does have heart disease that they don't. So 80% accuracy, although it looks good on paper, might not be enough for this context. And then that just leads into liability and morality concerns. So, an 80% accuracy might not be enough in this context. Otherwise, you risk some pretty hefty consequences. And yeah, that's it. Thanks for watching.